Loud. Okay, as I was saying, we're going to have two great speakers on mushroom poisoning today. First, discussing clinical aspect of mushroom toxicity, and second, specifically on Nepal. So again, thank you so much. I'm not going to take much time to do introduction. I'll introduce our first speaker. You already know him. He has given a talk to us before. I believe it was on heavy metals in the past. But Dr. Joshua Bloom, he is a faculty here at Brown, and he has been a poison center expert for us in our WhatsApp group as well, and has been supporting the Nepal Poison Center for a long time. So we're really thankful for him. Without any further delay, I want to introduce Dr. Joshua Bloom for his first presentation. You guys can please put your questions on the chat, and please do not unmute and talk during the presentation. Thank you. Dr.
Hello,
Bloom, it's
everyone.
all.
So again, my name is Joshua Bloom. All right, and I'm a medical toxicologist. I'm working with Dr. Carell over at Brown, and it's my pleasure to be invited. Thank you so much for having me to give this talk. I'm a big fan of mushrooms. It's one of the things that I enjoy about toxicology. So I'm very happy to talk to you today. So I don't have any disclosures, an outline of the presentation, and I know we just have a half an hour, so I'll do my best to be brief, but also as clear as possible. I want to focus on some general principles, the approach to a patient who comes in with mushroom exposure and possibly a mushroom poisoning. I also want to do a focus on cyclopeptide mushrooms, which is the Amanita genus, as well as a few other genera that contain those types of toxins, because they have special treatments, and also the course of the disease can be quite harsh. And then I'll also go over some cases involving other types of toxic mushrooms. So in terms of how you approach these patients, first off, if you have a patient who has an ingestion of a mushroom, you usually do not have access to the mushroom anymore. And that's because they've ingested the mushroom. And hold on, let's just make sure. And so oftentimes when you see these patients, you have at best their description of the mushroom. And since a lot of folks have access to the internet, they might pull up a picture of a similar mushroom, but you should be aware that many mushrooms look alike, and the best that you can often get from patients is the color, the general shape, perhaps the type of environment, and some very knowledgeable patients might even be able to tell you the types of trees that were nearby. But an important aspect that you can collect in your history is the timing, because that makes a big difference in clinically assessing and stratifying these patients. But some other information that you should consider with these patients is the intention. Right? That we're talking about the difference between a child walking around in the forest or a yard and picking up something from the ground and putting it in their mouth versus an adult who gathers a bunch of mushrooms and cooks them and eats a full meal. You can see that that would lead to different amounts of exposure. An amount also makes a difference. Then another thing to consider is whether the patient believes or can confirm that they gathered all of the same type of mushroom, or did they gather a bunch of different mushrooms that they thought were edible and eat them? And that makes a difference, right? Because if you're making identification, you now have to consider that multiple mushrooms might be involved, and that can lead to a mixed toxic syndrome, or multiple different types of toxicities, and that will also affect how you think about timing. And then I'll tell you that almost any, and especially like any wild mushroom and most cultivated mushrooms as well, can cause toxicity, and usually that's GI toxicity, GI irritation, especially when uncooked. So I say it again, any mushroom can cause GI symptoms, especially when uncooked. But there are several species that have their own specific toxicities that have to be considered. But a patient who comes in with just GI symptoms, that alone is often not enough to identify what mushroom they could have taken, and almost any mushroom could have caused that. But I will also say that most people who have an exposure to mushrooms, and even if they get a poisoning, they often do well. So thinking about this pre-hospital, this is where a lot of the calls to the poison center might come, is at least in the United States, as people who call because their child was in the backyard or in the forest and picked up something from the ground, put it in their mouth, and then spat it out. Now, one of the questions that's considered in American poison centers for these cases is, do these children need to be diverted to the hospital, or can they be managed supportively at home, and then the poison center can just do a check-in? Now, most of these children are managed at home in the United States, and that's because children generally don't swallow a significant amount of these mushrooms. And even if the child did, somehow put a Amanita mushroom in their mouth. You have to fully ingest those types of mushrooms, toxic mushrooms, to get their toxic effects. And there are no mushrooms that I'm aware of that cause important toxicity just by touching them or having them in your mouth for a few moments. In fact, many mushroom foragers and identifiers will check a mushroom's identity by tasting it and then spitting it out. And that's generally not dangerous. I will also tell you that as far as I'm aware, there's no case in recorded history of a child doing an exploratory ingestion of a mushroom and having consequential toxicity. So I want to start with this case. It's a 34-year-old man who has nausea and vomiting and diarrhea 7 hours after eating the mushroom on the left. And let's say he was very astute and took a photograph of the mushroom before he picked it up and ate it. His vital signs are here. You can see that he's tachycardic. He has a borderline blood pressure. His respiratory rate is 22. He looks to be in acute distress and has epigastric tenderness. I oftentimes do this talk with emergency medicine physicians, and I often have them think about the workup they would do, the treatments. But since we have a brief amount of time, I'll tell you that many doctors would approach this patient potentially by ordering laboratories, looking at liver and kidney function or electrolytes, and they would probably give an antiemetic. And the disposition is a good question here, right? Because an average patient who comes in with gastrointestinal symptoms and has benign laboratories, which I'll tell you that this patient likely would, oftentimes that patient might be discharged from the emergency department. However, in this case, that would actually be the wrong decision. Because this patient ate Amanita bisporigera. It's the mushroom on the bottom left. And this is just a bunch of photographs of Amanita genus mushrooms. And on the bottom right, you can see a picture of alpha-amanitin, which is one of the cyclopeptide toxins contained within these mushrooms. So if you look at these mushrooms, there's a few things you might see in common, and this is something that our mycology expert might be speaking more to in their talk. But these mushrooms are white colored or light colored, and they have white gills, and they also have a structure at the bottom of the stem, and that's called the vulva. So that structure arises from the egg form of this mushroom. So this mushroom grows and starts as the egg kind of structure on the left, and then it bursts out of that structure, and the remnant of that egg on the bottom stays as the vulva, and that's very typical of the Amanita genus. There might also be scales on the top of the cap of the mushroom, and that's a remnant again of the shell that was around the egg form of the mushroom. Now, unfortunately, I would love to be able to give you advice to always look out for mushrooms with a vulva, white gills, and a whitish color. But several other mushrooms can contain amatoxins, and these amatoxins are all highly concerning and can cause consequential toxicity. So the mushroom on the left is from the Lepiota genus, and the mushroom on the right is from Galerina. Both of these can contain amatoxins, and Galerina especially seems to contain a higher proportion of amatoxins than Amanita. Fortunately, we do see less Galerina ingestions, at least in our part of the world, because in this part of the world, Galerina tends to not be cosmopolitan. It tends to be more in forested areas, and less people are exposed to it. So this is the mechanism of how amatoxins work. And what you're seeing is a diagram of a hepatocyte. And so these toxins enter the cell through an organic anion transporter, or OAT. And then that molecule can have multiple intracellular interactions that generally lead to reactive oxygen species development inside of the cell, as well as inhibition of RNA polymerase. And this leads to hepatocyte death. So the primary toxicity of amatoxin-containing mushrooms is liver toxicity and can lead to liver failure. This is one of the toxicities that can have multiple stages, and there's oftentimes an asymptomatic stage that can last up to 24 hours, but generally, patients will develop gastrointestinal symptoms within 6 hours. Importantly, it's generally 6 hours or more, not 6 hours or less. So a patient who develops early gastrointestinal symptoms is actually reassuring, because mushrooms that cause rapid gastrointestinal irritation are generally not from the Amanita genus or related genera that cause that kind of toxicity. Now, this toxicity can proceed over several days, and it can appear convalescent, in the third stage of illness for about, 24 to 72 hours. Those patients are not well, though. They're developing hepatic toxicity, and they might begin to appear sick. But it won't be necessarily focalizing symptoms. And then finally, these patients can go into acute liver failure, and that can progress to multi-organ failure and death. So the management of this, and I will tell you the management of most mushroom toxicities is primarily supportive. But there are specific treatment options for this type of toxicity. You can use acetylcysteine in these patients. You can give activated charcoal, and activated charcoal can both prevent absorption when given early, but additionally enhance elimination because there's evidence that this toxin is enterohepatically circulated. Now, you treat what you see. So if you see liver failure, the general supportive measures for a liver failure patient would apply. If they have gastrointestinal symptoms, you can give supportive care for that. These patients are even amenable to hemodialysis, but unfortunately, that measure is only useful when done very, very early, and I'm talking within a few hours. That's because the toxin is not in general circulation in the blood compartment for very long. It sequesters to the liver and then is no longer available for extracorporeal removal. So there are several interventions that are used, I think, worldwide or are under investigation. And this is actually an out-of-date list because several other small molecules are being evaluated for this indication. I will tell you that none of these have strong evidence. Silibinin is frequently used outside of the United States. In the United States, it does not have approval by the Food and Drug Administration here, and that's because of the poor level of evidence supporting its use. Many of these are probably safe, but for example, penicillin G, polymyxin, those are antibiotics that have a high rate of adverse effects associated with them. So it's hard for me to recommend any of these treatments at the current level of evidence. I will also mention that a treatment that's employed, especially in Europe, is something called biliary drainage, and that's either a percutaneous procedure or done with a nasogastric tube that's extended into the duodenum. And so that procedure also does not have much evidence supporting its use, and it can be morbid. I want to give you a contrasting case. This is a 42-year-old who ate a mushroom from their lawn and had development of gastrointestinal symptoms within 3 hours. And severe nausea and vomiting occurred in this patient. You could see they're also mildly tachycardic. Again, I would usually present this to physicians and ask them what they would want to do. Many of them would do the same things as the previous patient. Do laboratories, basic laboratories to check electrolytes and similar things. They might give an antiemetic or an IV fluid infusion. And disposition would be the question again. However, in this case, this patient can likely be discharged if they're improving, and that's based solely on the time of ingestion in relation to symptoms. This patient likely ate one of the mushrooms on the top left or one of the mushrooms on the bottom right. These mushrooms are common mimics of choice edible mushrooms. The ones on the top right and the bottom left are actually edible, but you can see that toxic mushrooms can highly resemble choice edible mushrooms. And folks who do foraging but are not expert at it can make a mistake, find these mimics and ingest them and suffer toxicity. Fortunately, these mushrooms generally only cause gastrointestinal symptoms, but they could still be severe. And some of these patients will require continued supportive measures in the hospital and will not respond to an initial dose of antiemetics. So I want to give another case, and we'll proceed, with some other types of mushrooms. A 28-year-old who ate mushrooms to get high, so this is a recreational use of mushrooms, but she was brought in by her mother. You can see that, by exam, she has a tachycardia, a little bit of tachypnea, and has dilated pupils. Now, I would usually present this to emergency physicians who might, consider that this patient has ingested a common mushroom. This is called magic mushrooms or psilocybe genus. And many folks around the world ingest these mushrooms because they're psychedelic. Generally, you expect to see hallucinations, and most of these patients do not come to the hospital. The only cases I've encountered in my clinical practice are ones who were brought in by another person who was unaware of this person's use of these drugs. These drugs are often benign, even though they cause vital sign abnormalities, and they can cause a serotonin syndrome if the person has other serotonergic exposures. But many patients often do not need to seek care because they achieve the psychedelic experience they wanted. And patients who do present to care can potentially be discharged with a responsible adult or observed, but be aware that the effects of this mushroom can be long-lasting. So your observation time might be, 12 hours or more. This is a similar case of a 65-year-old who cooked and ate field mushrooms, again, to cause euphoria. This is a recreational use, but this patient looks a little bit sicker, right? They have an altered mental state. They are delirious, hallucinating, and they have a borderline temperature. They're febrile, and they have tachycardia. Many emergency physicians, especially in the United States, might work this patient up for sepsis. And especially with an altered mental state, they might consider, a CNS infection in this kind of patient. But this patient ate one of these types of mushrooms on the top here. And these are also amanita mushrooms. But unlike the amanita mushrooms I discussed at the beginning of the talk, these mushrooms contain distinct toxins, ibotenic acid and muscimol. All right. So these toxins act in different ways. Ibotenic acid resembles glutamate, and muscimol resembles GABA. And so you get patients, with this toxicity who have a mixed toxidrome. They look like they're on some kind of upper as well as some kind of downer. So they can have periods of lethargy or periods of hyperexcitability. You even see seizures. You could see a temperature in the setting of psychomotor agitation. The mushroom on the bottom right is actually an edible mushroom that can be but there can be a mistake done when a person is trying to pursue that edible mushroom and eats one of these unintentionally. The treatment for this is supportive. The toxicity can last for hours or days, and these patients often do well with support in the hospital. That's not expected to be lethal. Especially if you have a supportive history, you might not need to work up a CNS infection unless you have another source of concern. This is a new case, a 46-year-old who ate field mushrooms, and 8 hours after eating the mushrooms, she felt ill during dinner, and she got nausea, vomiting, chest pain, and diaphoresis. And you can see she has a tachycardia, a borderline blood pressure, and on exam, she has a flushed skin as well as, persistent diaphoresis. Especially in this age group, one might be concerned for a coronary syndrome in the presence of risk factors. And a lot of times when I presented this to physicians, they often think about ordering cardiac enzyme testing or electrocardiograms, which is all appropriate. But this patient consumed these types of mushrooms on the top, Coprinopsis. And coprinoid mushrooms, they all share, they're not all of the same genus, but they all share this property of deliquescing, so they dissolve into a black inky liquid, and that's how the mushroom distributes its spores. Many mushrooms of this type contain coprine, which is a compound that acts like the medication disulfiram, and therefore can cause a person to have a negative reaction when they consume alcohol. And that's what happened in this case. The treatment is supportive. The mushroom on the bottom here is coprinus. Coprinus mushrooms do not contain coprine, and therefore they are edible, even though they do share this deliquescing property. And unfortunately, because they deliquesce so quickly, they usually are not stored. They have to be eaten quite quickly. So this is another case. It's a 17-year-old who ate mushrooms from a park, and then 30 minutes afterwards started sweating profusely. All right. This is the vital signs of the patient. You can see that they have bradycardia, a borderline blood pressure. They actually are nearly desaturating on room air, and they have rails on exam. So this person seems to have a cholinergic toxidrome, and it would be completely appropriate to treat this patient as if they had a cholinergic exposure. The reason they have this toxidrome is because they ate mushrooms that contain muscarine. And so they are displaying muscarinic symptoms, and therefore the treatment would be an antimuscarinic like atropine, similar to any other patient with a cholinergic toxidrome. But one thing you have to remember is that I think, and especially depending on your practice area, cholinergic toxidrome might only be encountered or mostly be encountered in patients consuming organophosphate pesticides or similar kinds of compounds. And that treatment of those exposures is with atropine and pralidoxime or some other kind of oxime that can neutralize a pesticide. Remember that since this is muscarine only, pralidoxime or an oxime compound that neutralizes organophosphorus pesticides would be ineffective, right? Because this is not an organophosphorus pesticide. This is purely the compound muscarine that is agonizing muscarinic receptors. So an anti-muscarinic compound is the only treatment that's needed. Patients with this exposure generally do not require prolonged treatment. I usually don't expect this to last more than 12 hours, but they may require several doses of atropine and some observation in the hospital to make sure they have no further atropine requirement. I'm going to pause for a second because I see some questions in the chat, okay, which I can try to answer quickly. Can magic mushrooms cause schizophrenia in the long term? I have not seen evidence of that. These psilocybin and its related compounds are under active investigation right now to treat psychiatric diseases. And I will tell you that long-term exposure and long-term psychiatric effects is not well known to me. And single acute exposure, I do not expect to cause schizophrenia or a psychiatric decompensation after the compound has worn off. Now, another question I received from Pukar Is it possible to wash mushrooms? I have heard people saying it cannot be washed and it keeps absorbing water. So that if there's that question, there's two types of question there about washing mushrooms, and there's a question about poisoning and toxicity, and there's a question about cooking. I will tell you that mushrooms do absorb water. Most mushrooms, that structure of the mushroom itself, because mushrooms are fruiting bodies of a fungus, they're designed to absorb water, and they can be dried and then reabsorb water again. So washing them can cause them to become soggy, and that's like a cooking application. I will tell you, in terms of toxicology, toxins cannot be washed out of mushrooms. So washing will not remove toxins. And unfortunately, for many of these mushrooms, and especially remember this for the Amanita and amatoxin containing mushrooms, those toxins are heat stable. And so cooking will not work either. Let's move on. I see we have about 10 minutes left. So this is a case that I want to make sure we go over. It's an 18-year-old who tried to eat morels and believe they found morels, in the wild, and they ate them about 6 hours ago. Then 20 minutes ago, they had a generalized seizure and are still seizing on ambulance arrival, not responding to midazolam, a benzodiazepine. The vital signs are here. And, most emergency physicians, when I ask them about this, they're seeing this patient as potentially a patient with status epilepticus. All right, and this patient is having these symptoms because of exposure to gyrometrin, the compound on the top left here. Gyrometrin is metabolized to monomethylhydrazine, and that molecule acts similarly to isoniazid. And, similarly to that kind of poisoning, you can get status epilepticus refractory to benzodiazepines, and that's because of an effective pyridoxine deficiency. So the treatment for this is pyridoxine, vitamin B6, and usually with that treatment, patients will begin to respond to benzodiazepines and break their seizures. So the mushroom the patient believed they were eating is the morel on the bottom here, but they actually ate the mushroom on the top, Gyrometra species, the false morel. And so these mushrooms can very much resemble morel mushrooms, and morel mushrooms are a highly sought after edible. This is just something from recent research. This was published a few months ago this year. And we're seeing reports of this pop up worldwide, actually, from people who are exposed to morel mushrooms. Supposedly, these are non-toxic mushrooms when cooked. And experiencing severe toxicity. And in this particular outbreak, there were 2 deaths. All the patients had gastrointestinal symptoms only. And most of the patients in this report, and in many of the reports I'm seeing, ate the mushrooms uncooked. All right. So this is, to me, a reminder. I do not think of morels as having a particular toxin that you have to be concerned about, but you absolutely should never eat them raw, and you should never eat any wild mushroom raw, in my opinion. So I will go quickly through the last few cases. This is a person who ate a European mushroom and has diffuse body aches with red urine, okay? And this person has a presentation that's consistent with rhabdomyolysis. And that's caused by the tricholoma mushroom. So it's also called the man on horseback, which contains this toxic compound. And it's known to cause both systemic skeletal muscle rhabdomyolysis as well as cardiac muscle rhabdomyolysis. So you can also see troponin and elevation, cardiac enzyme elevation, and cardiac injury. These patients can get quite ill, and even the mortality can be quite high, especially due to the cardiac rhabdomyolysis. But it's interesting because I do believe many people eat these mushrooms for culinary purposes anyway, and may just expose themselves to toxicity. So the next 2 cases are similar. Both of them are patients who experience kidney toxicity. Both of them were eating mushrooms in the northwestern United States. So this person experiencing diarrhea 7 hours after eating a mushroom, and then developed an acute kidney injury. And this is a patient who ate Amanita smithiana, which is the mushroom on the top right. Again, you can see Amanita genus mushrooms with a vulva, and these mushrooms are white with white gills. Uniquely, this species of Amanita does not cause liver toxicity. It causes kidney toxicity due to the allelic norleucine in the mushroom. And unfortunately, they very much resemble tricholoma mushrooms, which are a choice edible. Now, this second patient, a very similar kind of case, but they're coming in with hematuria. And it looks potentially like a nephritic syndrome. They even have costovertebral tenderness. This patient probably ate cordinarius mushrooms. Cordinarius mushrooms can contain arelanine, which is a compound that resembles paraquat and diquat. So this class of compounds tend to sequester in particular target organs and cause reactive oxygen damage and potentially irreversible organ damage. So patients, who ingest these mushrooms, these compounds are affinity to the kidney and can cause an acute kidney injury and then potentially kidney failure. And some patients who have eaten these mushrooms have gone on to develop an end-stage renal disease requiring dialysis chronically. Our last set of cases involve patients who have exposures to mushrooms causing dermatologic manifestations. So this patient has a pruritic rash, and the more they scratch their rash, the more it causes what seems to be increased rash. And you can see they have a flagellate dermatitis diffusely across their trunk, right? And flagellate dermatitis, that means you can see that the formation of these erythematous spots, it's very similar to the excoriations, the places that they would scratch. This seems to be caused by lentinan, which is a component of shiitake mushrooms. Another type of mushroom that's eaten, frequently. I eat shiitake mushrooms frequently myself, but you're not supposed to eat these raw. It's not a guarantee that if you eat raw shiitake mushrooms, you will experience this toxicity, but some people seem to be vulnerable to it. Or perhaps it might be that they eat a large amount and they can suffer this side effect. It's not deadly, but it's quite uncomfortable. This is a case, and this is a person who was exposed to mushrooms in Japan, who developed these kinds of skin symptoms. And this is a rash of the extremities, frankly erythematous with hyperesthesia, so very tender to the touch. These patients, this is not a deadly outcome, but it's generally caused by acromelic acid from psilocybe mushrooms. And patients who have this type of skin effect from ingesting these mushrooms can often have it last for months and can be a source of chronic pain, even in patients who have these exposures. And finally, I want to just present an odd case that this has been reported in a few case reports. This is a 14-year-old who inhaled spores from a mushroom as a treatment for epistaxis, and this is an old folk remedy. This patient later presented with dyspnea, and you can see that their X-ray has pulmonary infiltrates. So this is called lycoperdenosis, and it's caused by the puffball mushroom. So this mushroom on the top here generally starts as a spongy, moist inner texture that dries out, and then that mushroom can pop and release a cloud of spores. And inhalation of those spores can cause a pneumonitis. So importantly, these mushrooms are quite edible and very favored, but that's only when they're young and the inner texture is still moist. It's also important to know that people might eat this mushroom or look to eat this mushroom and find the mushroom on the left here, which is Amanita phalloides. So young Amanita eggs can resemble puffball mushrooms. So lastly, I want to talk about this case, another skin manifestation, a 24-year-old with the rash that you're seeing in this picture. This person touched multiple mushrooms and they were concerned about which specimen caused the rash. I'll show you pictures of the mushrooms that they touched and the environment that they were living in. This patient is exposed to toxicodendron, poison ivy, and was not exposed to the mushrooms. And that's an important thing I want you to remember, is that folks who have some sort of non-specific symptom after going in the forest might have not been exposed to a toxic mushroom, might have been exposed to a toxic plant. And so you always have to consider that on your differential diagnosis. When you have access to a mushroom, for example, if a patient saved one mushroom or still has like one or two mushrooms available from the group that they gathered, and you want to take photographs to send to a specialist, you want to think of this as X-rays. So you need at least 2 views, and you want to be able to capture the gills, the stem, and the cap. You can bisect the mushrooms, and you can also ask the patient for photos of their growing environment. You can generate a spore print, which means you would place the mushroom cap gills down on a dry piece of white paper away from the wind. And then it would gather spores and form a print there. The color of that print is usable to a person identifying the mushroom. And finally, if you're going to be sending a mushroom, please transport it in paper, not in plastic. There are applications like cell phone applications or computer programs that can be used to identify mushrooms, but they're quite unreliable. And they've been studied multiple times. Oftentimes their sensitivity is just very, very poor. So just take home points I want you to remember. You should have some concerns about white mushrooms, all right? Because that should make you think of the Amanita genus and amatoxins and potential liver toxicity, and that can be delayed toxicity that might require observation in the hospital. Most patients will benefit from good supportive care, and many will not need more than that. And finally, please remember to call the Poison Information Center whenever you have a patient, or a case with a concerning mushroom exposure. They can help you think about the treatment for these cases and potentially work on identifying the mushroom. So here are some references that I used both to develop this talk, to develop my knowledge of mushrooms. Gold Frank's Toxicologic Emergency is obviously an excellent source. I want to highlight, though, there is a social media group by this title, Poisons Help Emergency Identification. I happen to have spoken to the administrators of this group, and it exists on Facebook. This is a group of worldwide volunteers who accept photographs of mushrooms for people or animals who might have been exposed and do their best to identify them. And it's a worldwide network, so they potentially have experts who, you might even be aware of Nepalese mushrooms. So in the absence of a Nepalese expert, which I hope you should have access to, and you would have access to with these real cases, this type of resource might be, might at least give you a hint as to, what the identification of the mushroom could be, and that could help guide your clinical management. It's not something I use very often in my practice because in the United States we frequently have access to mycologists or other myco experts who can give us identification that's more reliable. But if you're in a setting where you don't have access to any type of expert, these folks might be able to offer some help. Right, that's everything for me. Thank you so much for letting me come talk to you, and I'll just take a look at the chat briefly to answer any questions.
Yeah, thank you, Josh. Great lecture. Yeah, there are a bunch of questions for you. So if you can try to address some of those before you go, and then we'll introduce our next speaker.
Yeah, so I'll quickly address the ones that I can see. So are edible mushrooms found in a polluted area dangerous compared to ones grown in a healthy area? So the answer to that is complex. So the question here is whether a normally edible mushroom can be made inedible or toxic by growing in a dangerous area, for example, an area contaminated with toxic waste, or, this question frequently comes up when mushrooms grow in one's home, where it might be exposed to paints or other compounds that are used in the construction of the home. The answer is probably not. Mushrooms by their nature are used to growing in diverse environments and generally don't concentrate toxins that way. And I usually don't expect to see like external toxins causing toxicity for mushrooms. But there's never any guarantee with that, and it's impossible to say that those mushrooms are entirely safe. I would never eat mushrooms that were growing in a dangerous environment like that. What drug of choice for mushroom poisoning, or it depends on the type of mushroom? So yeah, the answer to that is that there's no specific antidotes that I would recommend. Even for Amanita, the specific antidotes that are utilized, there are many utilized worldwide, carry poor evidence. I would probably just use acetylcysteine and activated charcoal for an Amanita exposure. But other than that, I wouldn't particularly recommend any antidotal therapies. The evidence is just too poor. Now, doses of lentinula mushroom spores and mycelia can often cause does lentinula mushroom spores and mycelia often cause rash? I've not heard of that. So that's to Sanjay Singh's question. Pukar sent me a private message. I had one friend who tried psilocybin, had a breakdown and started developing abnormal behavior. Is there any correlation? So this is a question I received about a person who had an exposure to psilocybin and that had a psychiatric decompensation. There are multiple exposures that can cause psychiatric decompensations, and we see this with folks who have exposures to cannabis as well, but I wouldn't consider that an intrinsic toxicity of psilocybin. I still don't think we have much evidence, at all regarding chronic users. As the use might increase in the setting of psychiatric disease, we might get a little more information about this, but the answer is mostly I don't know. Are mushroom toxins heat stable, or are we able to make inedible mushrooms edible? So generally, the mushrooms I've talked about, one of the reasons that I bring them up is because they are heat stable toxins, even when cooked. You can experience toxicity. However, certain mushrooms like Gyrometra are commonly eaten, especially in Europe, even despite the fact that Gyrometra can cause, seizures and status epilepticus. These patients who cook these mushrooms will generally parboil them and remove the water over several cycles. And potentially that could decrease the amount of toxin, but it's just like anything else. If this is an inherently toxic thing, your measures might be insufficient and you can still expose yourself to toxicity. So I do not recommend anyone eat Gyrometra, even though there are reported ways to reduce the toxin. Does mushroom consumption have any impact on hematologic parameters like hemolysis? I don't have in my head any mushrooms that in particular that would cause hemolysis. That doesn't mean it's not possible, because many toxins, non-mushroom toxins, can cause hemolysis. So I don't want to say never, but I don't have any particular ones that my knowledge. Most cases of mushroom poisoning occur accidentally. We have several incidents. Can you suggest first aid measures to minimize the worsening of conditions? Yes. So I will say that, that's worldwide. Many mushroom poisoning incidents are unintentional. People are not eating these mushrooms on purpose to die. And so I will say, though, that first aid measures are generally supportive. Most of these most of these exposures will cause gastrointestinal symptoms, and most of the time, supportive care for gastrointestinal symptoms will be sufficient. For mushrooms like amanitas, you can consider things like activated charcoal, but that could be complicated by the gastrointestinal symptoms these patients can experience. You cannot do an X-ray of mushrooms. There's not much use unless you expect there's a metal foreign body inside of them. Accidentally, due to failed identification of poisoned mushrooms, is there any limit to do GI decontamination? Those principles are general. So GI decontamination to prevent absorption generally is a time-limited phenomenon, although we never know exactly how time-limited it is. But it probably becomes less useful the more time has passed since the ingestion. So that's the best answer I can give to that. But it's important to remember that for Amanita mushrooms, you can use things like activated charcoal, not just to prevent absorption, but to enhance elimination. So even long after the exposure, you could still give activated charcoal to hopefully remove it from enterohepatic circulation. Finally, can fomepizole help in poisoning as per your practice? The answer is no. I have not experienced any mushroom poisoning. I'm not aware of any mushroom poisoning that would benefit from fomepizole.
Thank you. That was the best rapid fire question answer session that I have seen. That was really great. Thank you so much. That was a fantastic lecture, and thank you for talking about those different variations of presentation with different mushroom poisoning and some options that we have. I think what you talked about at the end about mushroom expertise leads directly into our next lecture, which is fantastic. Thank you for setting us up for that. So without any further ado, I'll welcome our next speaker, who is Dr. Shiva Devkota. And now Dr. Devkota is a scientist at Gandaki Province Academy of Science and Technology. He has a PhD from University of Bern in Switzerland, an MSc in botany and MA in anthropology from Tubon University. He is a world expert in mushroom poisoning from Nepal with a specific focus on mushrooms that are found in Nepal. He has been honored with a naming of a fungal species under his name. It's called Lobaria devkote, from a Chinese group. And he has many ongoing initiatives in Nepal, including awareness programs on mushroom poisoning, mapping of underground mushroom network, fungal network in Nepal. And he has been many times referred to me as, hey, you need to talk to Shiva Devkota. He's the expert when it comes to that. So we are so happy today that we have found him, and he has agreed to come and join our webinar today to talk about the mushrooms of Nepal, specifically with identifying the poisonous species. So Dr. Devkota, the floor is yours, and thank you so much. You're on mute. There you go. You got it.
Can you hear me?
Yes.
Great. Thank you very much. Thank you, Dr. Ram Karel, for this wonderful arrangement and for all the participants in this webinar. So namaste, I am Shiva Devkota from Pokhara. Actually, I'm working as a scientist at Gandaki Province Academy of Science and Technology in Pokhara. So today I'm gonna present about the ground reality on mushrooms. So what Dr. Bloom has said is all about science, but I'm highlighting some real scenarios from the field, real scenarios from the remote parts of Nepal. And I want to share what's going on in different corners of Nepal and what I have been doing on this kind of mushroom poisoning stuffs and other things. So without further delay, let me start my presentations, because basically I'll be talking about the very basic thing about mushrooms, because So today I'm gonna discuss about some introduction of mushrooms and from Nepal and their morphological features, and some poisoning scenarios in Nepal, and then some common poisonous mushrooms. I want to share some pictures from Nepal, and we will discuss about some insights and discussion for the betterment. So, talking about the typical structure of mushrooms, because many of us might not know about the typical structure of mushrooms, because normally the important features of mushrooms are like, as Dr. Bloom already said, we need to look for this kind of vulva and the sac-like structure. There is sac-like structure, and which we normally miss. And there are also kind of scales on the cap. So these are common but unnoticed feature. And also there might be a ring or annulus like structure. So this is the typical mushrooms. But apart from this kind of typical mushrooms with gills and caps and other things, we have also several kind of mushrooms in Nepal. Like some mushrooms they really grow on soil. Some mushrooms they really grow on dead stump or wood, and some mushrooms that really grow on some insect. So we have different kind of mushrooms in nature. So not only with the gills, and much of the mushrooms they have their own kind of toxicity, and they have their own type of uh, behavior. So because I work in Nepal, and then I think I thought, why not to share something about the mushrooms in Nepal, because is you guys are to cure patients, and then you should know. I think we should know about the mushroom diversity in Nepal, because so far in Nepal we have like 229 different kind of species. And I would say it is this kind of field. I mean, mushroom field is still overlooked. And I guess we have more than 10,000 species in Nepal, but so far only 291 species have been reported. And if we look globally, about 14,000 mushroom species are reported, and of which 1 to 10% mushrooms are predicted to be poisonous. If we look in Nepal, so out of 1,291 species, there are like only 159 species of edible mushrooms. That those mushrooms are being really used by local communities. And there are 74 medicinal mushrooms for different purposes, and some 100 mushroom species are supposed to be toxic. And there are few more those mushrooms are being used for either rituals or spirituals and other decorative purposes. So here in these pictures you can see some of the mushrooms. These are really very good, very beautiful mushrooms, because and also these mushrooms are not with their typical cap like structure. Like we have a few cordyceps sinuses, that is Erta caterpillar fungus, and we have Torvinellus flocosus, that is without cap. So we have different varieties of mushrooms in Nepal, and of course there is one Amanita species and there is one Sulos species. So some are edible, some are poisonous. I will describe later on. With this, because as far as I know, the prime intention of this presentation is also to minimize the mushroom poisoning cases, or to make people aware about mushroom safety. And then talking about that, I think it would be nice to discuss about the most, in Nepal, like from 2,500 to 3,000 meter altitudes, where we could find Pinus wallichiana forest, that's the Sol Loco forest, Pinus wallichiana, Sugar Mimosa, and Abies forest. That's the very good forest for mushroom diversity. And in our earlier research, we have found varieties of mushrooms in this altitudinal level. And if we look, because we are talking about mushroom poisoning, and if we look to the mycophilic communities, mushroom loving communities, mainly Tamang, Magar, Gurung, Dalit, Chetri, Bhotia, and Thakali, Sherpa, Newar. These are supposed to be mushroom loving communities. And if we look to the census, 2021 Nepal census, Tamang community represents only 5%, about 5.5%, and the Brahmin community represents 11%. But if we look their mushroom consumption behavior, Tamang people they eat like they consume 56 different varieties of mushroom, different species of mushroom in Nepal, whereas the Brahmin community consume only 27 different varieties. So why I'm showing this graph from our research is like, because that's the main reason why Tamang communities are more vulnerable to mushroom poisoning. So we should work among the Tamang communities people. We should work among the Magar communities people because they are the real victims. They are the real mushroom loving communities, and they are also the real victims because of mushrooms. So in next, talking about the morphological variants of wild mushrooms, because as Dr. Bloom said, Dr. Bloom has highlighted several cases from the USA, but the real scenario is Nepalese because we have several incidents tragically every year, but we don't know which mushrooms they have consumed. You know, because some cases are really far from the district headquarters, they are far from the hospitals, and then such cases are not easily, we cannot approach them easily, and we don't know which Muslims they really consumed. So, with this, thinking about the Nepal scenario, I think it would be better to discuss about the different morphological variations and the poisoning cases, possible poisoning cases related with such mushrooms. Because, as I already said, there are different varieties of mushrooms. They have their own kind of forms. Either the cap is like umbrella, either the cap is like trumpet like, either the star like, and whether their cap is convex, whether that is spherical. So we have varieties and varieties of mushrooms. First, we should know about types of mushrooms. So let me show you some of the let me share some of the mushrooms from Nepal, because as we are talking about the poisonous mushrooms, what I found so far is most of the mushrooms which bear gills, also called lamella, those mushrooms are mostly poisonous mushrooms among the all types of mushrooms. So here you see that there are some lamellas or gills, because actually those gills are, I would say, spores producing sites, and most of the poisonous mushrooms they bear gills. And apart from that, there is another type of mushrooms, because in our earlier pictures there are gills, but in this picture you see there are only pores, not gills. So most of the mushrooms with such kind of pores, they are not so poisonous like that of mushrooms with gills, but many are good edibles, but some will make you sick. So apart from that, there are some more mushrooms with pores, because this is the fleshy mushrooms. This is very soft. This grows on ground, but this is the mushrooms. This grows on woods, and these mushrooms also bear pores. And such kind of mushrooms are not deadly poisonous. So all the pictures which I'm showing, they are from Nepal. So I'm just thinking about Nepal, and I'm thinking about the possible poison species from Nepal. And if some claim that they eat this kind of mushroom, then they might not be poisonous mushrooms. So because mushrooms growing on woods, normally with pores, they are not so poisonous mushrooms. And also there are other kind of mushrooms. They have teeth, neither pores, neither gills, but they have really, really teeth-like structure. And such teeth-like structures, mushrooms, several are good edibles, and some might be poisonous, and they may bring some confusions. Apart from that, of course, pop balls. Dr. Bloom said these are the pop balls which I found in Annapurna region. So these pop balls, these kind of pop balls are normally edible, and there are some this kind of mushrooms. Those are twice edible or not edible, but normally these kind of mushrooms are not poisonous mushrooms. And you see the earth star. So this is also not poisonous mushrooms. And if you've been to the mountainous part of Nepal and in the countryside of any parts of Nepal, you could see such kind of cauliflower mushrooms, I would say, or corals mushrooms or ramaria mushrooms. So not all, but such kind of corals mushroom are also poisonous mushroom. But we need to be cautious. But all not but this kind of mushrooms are also not so poisonous mushrooms. And you will see different varieties of mushrooms. I mean, these are the dead man's fingers, and such kind of mushrooms are not edible. People do not eat it, of course, and actually those mushrooms are not poisonous mushrooms. And there another variety is like a jelly mushrooms. Those kind of mushrooms are normally edible mushrooms, and but has very little taste. But those kind of mushrooms are edible mushrooms. And of course, the Morcella or Guchichiao and other mushrooms with cups and models-like structure, those are also not literally poisonous mushrooms. But Dr. Bloom said there is on Gyromitra infula, yeah, Gyromitra species that is poisonous. But because here I have not shared Gyromitra pictures because Gyromitra is not so common in Nepal. So Morcella Guchichiao is very common in western part of Nepal, like in Dolpa, Jumla, Jajakot, Humla, and Mugu, and even in Manang and even in Mustang area. So we don't have much problem. We don't. I have not heard any problem with Gyromitra influenza in Nepal. That's why I have not shared that pictures here. Uh, okay, and the important thing is whenever we see mushrooms, because we always need to focus to find its complete structure. The complete structure means whenever we pick mushrooms, there might be this white like sac-like structure. That's a vulva. It's called bag of vulva that might be underground. That might be hidden. So when people collect mushrooms, they might collect only stalk and cap or pilus, and they do not notice about this kind of vulva structure, and they get confused with poisonous mushrooms. So while taking mushrooms, we need to pick every part of mushrooms so that it will be very easier to identify whether it is edible or poisonous mushrooms. So apart from that, we also need to check, and as a medical officers and medical experts, I think you need to also ask your patients about whether the mushrooms bear any latex, or not. That could be one identifying characters, because most of the mushrooms which bear such kind of latex, they are edible. Of course, there are some mushrooms, they are really bitter, and the taste is not good, but they are not deadly mushrooms. So, and whether the when you brush it, whether color changes or not, such things could be asked to the patients or their relatives or collectors. So apart from that, whenever you get mushroom poisoning cases in remote parts of Nepal or in the city area, better to ask if mushroom color has been changed or not, because normally because of the oxidation, color might be changed. And what's the size of the color? What's the size of the mushrooms? If the color changed, and such things should be asked to the people or the person who you consume mushrooms. And also, because we are in Nepal and we need to work in the very remote areas of Nepal, we need to treat the people in remote areas of Nepal. So it is not always a case that we know which mushrooms they have eaten. So whenever it is always better ask people to take complete picture of mushrooms from where they have picked up that mushrooms or collected or harvested that mushrooms, whether that is from the dung or from the forest or from soil or from where. And then better always used to take pictures from the upper part of the cap and the lower part of the cap, showing the gills and the stipe or stalk. So we need to get every part really visible to identify mushrooms. So we should always ask them to take pictures from close-up pictures and pictures from distance. So uh, as I have been working on mushrooms since long and mostly in remote areas, whenever and wherever I visit the places, there are people used to tell me like, okay, these some mushrooms growing on live trees, they are edible. They have such kind of feelings, they have such kind of beliefs. But they're good. I mean, their beliefs are good in terms if they eat pleurotus mushrooms. Pleurotus means the Western mushrooms which we can buy in market, and lentinus mushroom, Laetiporus mushroom, this is good. But if the mushrooms like Omphalotus oli area, that also grows on living trees, but that is already poisonous mushrooms. And some people believe that the mushrooms growing on drinking straw or manure are poisonous, but not the that case is not true in all cases. And some people believe that soil inhabiting species are deadly poisonous, but that's not the case. Some people believe that bright color mushrooms are poisonous, but that's not the case. And mushroom with rough, warty caps and texture are poisonous, but that's not the case. And the people who believe that whose flesh changes after touching and brushing are said to be poisonous, and that's not the case. So whatever the beliefs that the beliefs are rooted among the leftist people, so beliefs are really, really misguided. And we should not encourage people to run after those beliefs, and none of those beliefs are correct. That's the main reason why every year such kind of tragedy, occurs and reoccurs. So even killing 14 people, even killing 6 people, and then not only in rural areas, even in urban areas, even in suburban areas. So these are the real scenarios in every year happening in Nepal. So I would like to bring some simply three cases where I was really participated to educate people, to make them aware, because it was long back ago in 2005 in Palpa, because 12 people were died and about 40 people were hospitalized. During that time, I was working in Mustang area, and in next day, I went to Palpa together with my mycologist friends, and we went to hospital. We talked with health officers, and we talked with the victims. We talked with the survivors, and we asked survivors to join with us to hunt mushrooms. And then we went to Palpa, Srinagar area, and then we found they said that okay, we consume these mushrooms, and then we went to forest and we found these Amanita phalloides mushrooms. So this is really a death cap mushrooms, and we also found Amanita longistrata mushrooms in the forest. So because we were lucky enough to get such mushrooms, I mean, though that was a serious case, and then in next day we make aware to local authorities and FM stations, radio stations, and journalists and administrators, and then next day they make a kind of announcement to the local people. So those were the case. So in fact, this Amanita longistrata, it was not reported earlier. When we reached there, we found this Amanita longistrata already growing there. So what I'm to say is like because as I said, we have only 1,200 mushrooms reported so far. So we don't know which poisonous mushrooms are growing where. We need more explorations. We don't know. We have very less exploration. So there might be several other poisonous mushrooms growing somewhere in Nepal. And later on, we also talked with the doctors there at Palpa Mission Hospital, and later on they published the paper, acute mushroom poisoning, a report of 41 cases. Um, if you like, you may have a look. And this is also a case not far in from Chittagong, because we came to know that 8 people from a single family. Okay, just a single family died after consuming poisonous mushrooms, because we came to know this incidents. But during that time, I was doing my PhD in Switzerland, and I could not join. But later on, when I came to Nepal, then I went there, and then I asked the people actually what had happened during that time, and I could not figure it out which mushrooms they might consume. They have consumed, uh, but that was the case. That's a very tragic case. And another case is from 2021 from Pokhara, and where 8, including children and elderly, fell ill from consuming poisonous mushrooms. So next day, I went there. I visited those places. I visited those victims' families. And then children's, I talked with children's, because children collected mushrooms and they prepared dinner for their parents. And I came to know that they consume these Amanita subcolosa mushrooms from that forest. And then, of course, I made awareness camps to them. So these are some cases, local, like from local scenarios. So apart from that, in these days we are making a kind of systemic review of the poisoning cases in Nepal, looking after these after last 15 years cases, and still we need to produce our paper. But we could see there are several mushroom poisoning related papers from all over the world, but it is still lacking from Nepal, and there are only very general paper like overview of mushroom poisoning, but we don't have real data. We don't have real data like how many people died because of mushrooms, and which areas are really hot spots and which communities are really hot spots. Then after knowing such areas, after knowing such communities, then we can develop projects, and then we can implement our projects directly, working with such communities. So that is what I'm expecting to do in next year. So we don't have real data from Nepal. So I just took this slide, a piece of table from basic data of each symptoms type of mushroom poisoning incidents in China. And most of the cases there in China are acute liver failure. So I'm not talking about much about this kind of science, because I'm not from this background. I'm mushroom taxonomist. So I'll talk more about it. So I would like to bring some pictures about the common poisonous mushroom of Nepal. So this is Amanita citrina. This is very poisonous and reported from Nepal. This is Amanita longistrata. We reported it from Palpa. This is Amanita pantherina. This is Amanita phalloides, death cap. This is Amanita fulgiana. We reported it from the Everest area. And this is Calabolitus paniformis, also from Everest area. So these are some of the poisonous mushrooms. So and then another is possible causes of poisoning in Nepal is because you see, this is Amanita chepangiana. Amanita chepangiana is edible mushrooms, mostly, and it is reported from Chittagong, Lothar area. And there are similar mushrooms, Amanita virosa and Amanita citrina. So what happened, in my understanding, what happened in Chittagong, because the children, they thought that they picked up Amanita chepangiana, but mistakenly they picked up Amanita virosa or Amanita citrina mushrooms. So it might be cases from Chittagong, and this is very serious case because Amanita sepangana is edible, and similar looking another mushrooms is poisonous. And not only this, there are other mushrooms. So whenever I visited several places, there were no any materials to share with the people, and there were no any pictures to share with the people. Then we decided to bring these posters with common mushrooms, some common poisonous mushroom of Nepal. So here you see some Amanita muscaria, Pachyllus, Amanita longistrata, and there is also another poster in Nepali. So I have contributed with pictures and text, and were produced by Gondik Province Academy of Science and Technology and Department of Plant Resources Ministry, from ministry level. So these are some of the innovations to initiations to our people in Nepal. So in these pictures, if you see clearly, most of the poisonous mushrooms are from Amanita. And and also apart from Amanita, there is one Galerina marginata. This is from Manang, and this is Mycena pura. This is very common everywhere. And this is Pachyllus involutus, and this is also very common everywhere. So apart from Amanita, there are also a couple of mushrooms, but whenever I visit rural areas, I always used to tell people, for the very layman people, because do not eat any mushrooms if such mushrooms bear warts. Okay, if you look this mushrooms muscaria, if you look this Inatifibriella, if you look this concentrica, if you look this Amanita subglobosa, so those all mushrooms bear warts on their cap. So this is the best way to avoid mushrooms, and you could tell people, to you could tell people to make them safe. I mean, just tell them do not eat any mushrooms with words. And another is like do not get confused with Amanita chepangiana and Amanita virosa and other mushrooms. This is also very common. And another is do not eat any similar looking mushrooms, because when the people from eastern part of Nepal, they travel to western part of Nepal and they think that this is the same mushrooms which they have been eating. But the problem is they always used to get confused and they will pick up poisonous mushrooms. So never ever eat any similar looking mushrooms. So those are some of the tips. And these are the questions which we have produced, and these are we can assess them from web or internet also. And as I said, hematoxins is the problematic. So there are a couple of mushrooms like Amanita phalloides, Pachyllus involutus, and Cortinarius species like with Amanita, they contain with muscarine and paxillin and orlanin. So as Dr. Bloom said, so I'm not going to repeat the same thing again, but these are the mushrooms, typical poisonous mushrooms in Nepal. So what measures are needed now? Of course, because why I'm sharing those pictures is because I always love to work with very common people. I always used to travel in remote parts of Nepal, and I always love to make people aware. So my concern always is to make people, we should document first what are the mushrooms we have in Nepal. That is scientific documentation. Another, we always used to document what people are eating, you know, what people are eating. That is really very interesting. And then I always used to travel and I always used to know which mushrooms they have been, eating since long. And another is, in the meantime, it is really a good opportunity to make them aware. Okay, please do not eat these mushrooms. Please do not eat mushrooms with words. Please do not any similar looking mushrooms. So this is also a kind of opportunity. So what we need to work in two spheres. One is scientific spheres and another is social spheres. And apart from that, it is really, really very nice that now we have Poison Information Center in Nepal. I mean, because I worked like 9 years in Switzerland, and then there we could find mushroom inspector, everywhere in Switzerland. So whenever people used to get collect, whenever people collect mushrooms, they used to ask to the inspector whether it is illegal or not. So there is one case. I mean, there's news from CNN, I guess. Mushrooms popularity is blooming, but so are poisoning expert one. So mushroom hunting brings spike in poison control cells. So these are some common things we should understand, and we should make people aware with our science and with our knowledge. And in the nutshell, I think what I realized is I think we need to enhance training for primary care physicians to recognize hematoxins poisoning and provide appropriate treatment. And we need to seek immediate medical attention for symptoms like vomiting and diarrhea after consuming wild mushrooms, and treat symptoms occurring more than 6 hours post ingestion with urgency, indicating potential amanitin poisoning. And we need to increase awareness, research, and outreach effort. So important thing is we need to document the about the poisonous mushrooms. We need to document the mushroom diversity in Nepal. We need to make people aware, and we need to make them we need to I mean, another case is like we need to make them so aware that they need to rush to the hospitals, okay, for their treatments. So with this, I would like to thank you all for your guys' attention. Thank you very much.
Thank you, Dr. Shiva Devkota. It's a really, really great lecture. And it's really good to know some tips that you shared, especially the warts on mushroom. I think that's a very easy thing for us to remember, to make sure we avoid mushrooms. And I don't know if there are any questions for Dr. Devkota, but I just wanted to ask you a follow-up, Dr. Devkota. Where can we get the information on like the sort of public health awareness items that you have mentioned, that you have created? Where can we find those information to share with people through the Poison Center?
Mm-hmm. So there is one link. I would like to share that link from Department of Plant Resources. I will share that with you all.
Okay.
And I can also share a PDF version of posters if you like, and you can just print those posters to share with people.
Okay, that would be really helpful because we can start sharing those as well. And then, is there any questions for Dr. Devkota? I know you guys had a lot of questions earlier that have been answered. I wanted to thank our speakers today, Dr. Joshua Bloom. He really gave us a nice overview of toxicity from a clinical perspective, and Dr. Devkota gave us a nice overview of mushrooms in Nepal and what to watch out for. So we're forever thank you for both of you for joining. We'll have this lecture uploaded on our YouTube page. So please be sure to check that out. So we'll have that uploaded by tomorrow. Also, please fill out the feedback form if you want to. I believe you can get some CME credit within Nepal for this. So if you fill that out, the form has been shared on your chat here. That'll be really helpful. And we look forward to having you join us at our next webinar in the next month. Stay connected. Remember, our Poison Information Center phone number is 450-2011. Right? It's very easy. Please save that. And we will see you next time. That's all for me. I don't know if there's no other questions, we can see you next time. Thank you, Dr. Devkota.
Thank you very much for this wonderful opportunity, and it's really necessary to make people aware, and then it's really a very good initiative. Thank you very much.
Thank you.